We begin today with CDC Director Rochelle Walensky continuing to tout a wildly misleading study that the CDC knows has been discredited as a reason why millions of children across the country should be masked indefinitely. On December 17th, we interviewed journalist David Zweig. He writes for The Atlantic, New York Magazine, among others, regarding his months-long investigation into the study published by the CDC in September. Okay, it suggested, the study did, that schools in Arizona that did not mandate masking were 3.5 times more likely to have COVID outbreaks. This appeared to confirm the CDC's own obsession with masking, and the agency's director, Walensky, was quick to promote it nonstop all over the news.
We also published a study out of Arizona that demonstrated that places that had no masks in place were 3.5 times more likely to have outbreaks than places that did have masks in place.
To a study that was done in Arizona, published on Friday, that demonstrated that in jurisdictions that had masking early in their school year this year were 3.5 times less likely to have outbreaks in the school.
But the study that you're referring to in Arizona demonstrated that schools that had masks were 3.5 times less likely to have a school outbreak than schools that didn't have masks.
We have new science.
You see, it goes on and on. But David Zweig, having dug into the previous studies touted by the CDC on masks and found them wanting, had questions. 3.5 times is a huge factor. Not even the previous, albeit largely unsound, studies touting masking had suggested that masks make a difference that big. So he decided to investigate the study's methodology. And here are a few highlights of what he found. 1, the study cited more schools than exist in the counties observed. It compared schools that were open for 3 or 4 weeks with some that were open just 2 weeks. In other words, how do we know if a no mask mandate school, a more free school, that saw more COVID cases had an uptick because of its no mask mandate policy, or simply because it had, say, 2 extra weeks of classes factored into the results than the fully masked schools did? If I want to compare one school for 30 days that didn't have any masks with a school over 1 day that had masks on, guess how it's going to turn out? The school that's open 30 days is going to have more COVID cases. That doesn't say anything about masks. The study even cited masking data from schools that were still in virtual learning. Okay, I'm sure that a school the children never step foot into, but which happens to have a mask mandate, is very effective at stopping the spread of COVID. One scientist David spoke to called the study so unreliable that it probably should not have been entered into the public discourse at all. Walensky's team knows all about David's investigation. Again, this is not a Fox News partisan host or even straight news journalist that they can easily dismiss as of the right wing. He's not. He's been a straight shooter right down the middle from the beginning of this, and they're trying to blow him off. He says they were made well aware of his findings. His article made major headlines, and when he asked them to explain why they are touting this study, despite its obvious and serious flaws, they went dark on him. So did Walensky or the CDC retract or update their findings? No. Did Walensky at least quietly stop talking about it? No. Instead, this week, she promoted it again during a U.S. Senate hearing.
We have new science that has demonstrated the value of masking. 3.5 times increased risk of school outbreaks if you're unmasked in schools versus if you're masking in schools.
She can't stop herself. Meanwhile, she's wearing 40 masks for people who aren't watching this. I mean, she's mummified her face. David Zweig is back with me now. It's crazy. These people okay.
A lot of masks.
When you heard her do that, once again at a Senate hearing, no less, mention this discredited study, what was your reaction?
I was, I guess, a combination of astonished, yet also not surprised, considering the track record that's happened thus far. It's, I have a couple sources inside the CDC, and to me, the main thing I'm trying to find out is, does she actually not know what's going on? Or does she know and is, making some sort of strategic or political decision to continue to cite a finding from a study that I think any reasonable scientist or academic would say is widely discredited at this point.
Mm-hmm. Would have abandoned by now. What light, if any, does it shed on your query? Watching her with Brett Baer this past Sunday, dodging and weaving on just calling out Sonia Sotomayor, which even the left-wing fact checkers have been willing to do, falsely asserting that 100,000 children are in the hospital because of COVID right now.
Yeah, I think there's something that is deeply unsettling when you see someone who is ostensibly grounded in being a scientist communicate in a manner that we typically would associate with a politician. And I think as Americans, we need to think about and decide, is the CDC itself a political organization? And is the head of the CDC essentially a politician? Or is this person a scientist and trying to communicate the science to the American public? Because those things together don't seem to be working right now.
Mm-hmm. There was a question when you last came on about just how far she'd gone in defending that 3.5 times number. And we played this soundbite between Rochelle Walensky and Chris Hayes of MSNBC, where she went even further. You had given her maybe a little wiggle room. Let's see that she went even further. And it was a stunning moment. I want to play it for the audience who hadn't seen that exchange. You should go back and look at our interview with David on December 17th. But this is the longer soundbite, Deb, where we've got Chris Hayes pressing her and what she says. Okay, listen.
The study that you're referring to in Arizona demonstrated that schools that had masks were 3.5 times less likely to have a school outbreak than schools that didn't have masks.
Just as a follow-up, are we sure that's not a correlation issue and not a causation, which is to say, like, there's higher levels of community transmission in the school districts that are also the ones most inclined to not have a masking policy? See what I'm saying?
Yeah, no, and that's actually been studied as well, and we've examined those correlations for exactly the concern you raised. This is an independent effect of masks.
That wasn't true. And did you ever follow up with them, and did they ever give you a response as to why she said something? I mean, that not even the study's authors, I think, were claiming that was the case.
Yeah, I mean, they stopped responding to me after a while. In fact, my editor at The Atlantic had to start communicating with the authors and with the PR person at Arizona State University, where the lead author is located, because they wouldn't even reply to me. Which, to me, when I talk about it in the article, or at least you and I had spoken about this, which is, that's the thing that I find in some regards the most troubling, is that, again, a public health agency, if nothing else, should be based in transparency. This is not part of the security apparatus. This is not the CIA. We're talking about, they're supposed to be for us, the people. And they were presented with very clear evidence of significant discrepancies. This is not about a pesky journalist bothering them. This is not about scientists quibbling over the methodology. These are significant discrepancies in the numerical, in the statistics of the study that I found from the state of Arizona and from the county of Arizona that were very, very different from what was in the study. And they wrote back to me and said, there are no errors. We're done.